Hey guys, Nurse Cat here. Welcome to my channel. This is Nurse Cat. It's been a while that I haven't uploaded. Pero ngayon mag-upload tayo. Maglalaro tayo ngayon ha. So I was asking ChatGPT about a question. I said, if you are a new nurse and wants to make an interview to a seasoned nurse like me, what are the 5 questions you will ask to me? So we will let ChatGPT ask questions to me, then I'm gonna answer it promptly to you guys. So it's reading right now. Let's say, here are the 5 powerful high-yield questions a new nurse would ask. Let's see natin ha. Number 1. What helped you become confident as a nurse, especially in your first year? Oh, it was my first year. So I graduated 2009. So sabi niya, what helped you become confident as a nurse, especially in your first year? Become confident, number 1 when I was still in the nursing field was to know the routine of the unit. Number 2, know my patient's assignment. So sometimes I struggle with time management. So that's normal to everyone. You will really struggle on time management. So the best thing to do is to check your assignments ahead of time. I normally go mga 30 minutes to 20 minutes before shift change and read my assignment if I could. What helps me pa to be confident is to study the diagnosis of my patients after work and if I'm on my days off. What else? What make me confident is to understand why the doctor ordered such things to the patient and what the medicine is for. Like, you try to connect the dots in every situation and keep away from being so task-oriented. Also, I looked for a mentor. It's not really yung ikaw ang mentor ko. I pick someone who is humble but wise in the unit, who I can trust and ask question with. And sometimes I would ask to go out for lunch with them. I try to be with them pagka lunch break. Yan yung mga pinupuntiri akong kasama. Question number 2. When you walk into a shift, how do you prioritize your patients effectively? Ayan. When I walk into my shift, of course, you will have to, I mentioned earlier, I go ahead of time to read my patient, check how many medicines should I give on that particular patient, check their contraptions, if they have like tube feeds or they have like TPN. On top of that, meron pa silang mga wound vac, probably some G-tubes or any other drains that I need to do. If they have multiple antibiotics, see their vitals as well, if the trend of their vitals is if they have fever or whatnot. Those how I do my prioritization with my patients. I don't prioritize those patients who are just keep on calling for a particular who literally just keep on calling for sometimes nonsense I prioritize them based on their clinical features and the the reason why they're there. Comorbidities, airway, breathing, circulation, to keep it short and simple. Number three, what's a mistake you made early in your career and what did it teach you? Okay. No, it's not my first Code Blue experience eh. What's a mistake you made early in your career and what did it teach you? So, my second Code Blue experience in my career. So, I was working in a private hospital that time. I had 10 patients. And since I don't have time to really read and understand the situation of the patient, the patient was transferred out from ICU direct to our floor. Then the patient was able to like swallow meds and everything. I didn't remember getting a report from the ICU nurse at that time, or probably I was so focused. And then we had a change of shift, almost change of shift. I'm already giving report to my senior nurse, and then the family member went out. Tapos nagkaroon ng code, so code blue situation. Our hospitalists at that time were on a conference, I think. And then, thankfully, there's a late rounds of that cardiologist who helped us with that particular patient code. So, the mistake I did is, the doctor asked, what's the diagnosis of this patient? Sabi, kasi sa Pilipinas, we don't have monitor eh. We only have the charting. So, I mentioned something which is not really the diagnosis of the patient. I should have said, I don't know, which is the clear, better answer. So, I assumed and presumed. And I think I said something which I've forgotten what it is. And then, it became an issue kasi mali daw yung sinasabi ko. So, if you don't know, just admit that you don't know. Those are my younger years nursing mistake that I made in my career. And it teach me to be humble. Frankly, to be humble. If you don't know anything, just tell them I don't know. I wasn't able to read because I'm busy. That's okay. From then on, if I don't know, I don't really know. I will tell them I don't know. That doesn't make you any less than a nurse if you don't know. So, yun. Number 4. How do you handle difficult patients or workplace conflict without burning out? How do you handle difficult patients or workplace conflict without burning out? Okay. Probably I don't take it seriously. I listen to the person who asked me. I listen to the patient who's having problems and try to analyze what they really mean about their complaints, what they wanted to happen with their complaints. Sometimes we go ahead of our perception sa patients eh. So sometimes the best thing to handle difficult patients is to listen to them. And some patients really make sense if they try to complain to you and you listen to them. You were able to resolve or meet halfway without burning out. Just try to listen to them, and then after that, after your work, clock out, don't think about it anymore. Don't think don't take things seriously. You will not gonna burn out. Another thing, say for instance, is if your patient is very manipulative, set limitation so you won't burn out. If your patient or family keeps on calling, delegate so you won't burn out. Delegate with your CNA. And if you see that your CNA is already fed up with that patient, pull them out on the situation. Then you cover as well. That's it. And then I learned how to pick my battles. So there come a time you don't really need to win every argument. Sometimes the best thing to do is to just understand them. But I'm not telling that you don't have to you tolerate them. I was telling na it's okay to set limitations for those who are very manipulative patients. So, number 5, haba na ng vlog na to. Impromptu to ha. What habits or mindset shift help you grow from just doing tasks to really thinking like a nurse? Ha? That's a question mo ha. What habits or mindset shifts help you grow from just doing tasks to really thinking like a nurse? I would say habits and mindset, thinking like a nurse. There was one senior nurse that I was able to chat with before, and I said, "Ma'am, how are you able to uh, to complete your task? How do you manage your time with your patient?" You know what she said? She said, focus. That word, focus. I said, oh nga no. I have to focus. That should be your mindset to transferring from being a baby nurse to thinking really like a nurse. You have to focus. You have to ask questions. Oh, so why did the doctor order this laboratory? Oh, why did the doctor order this medicine? What is this for? Why did the doctor consulted this blah blah blah? So you have to like connect the dots and think about the welfare of the patient. And the more you understand and think like a nurse, you will be able to coordinate things with everybody else. You are already 2 to 3 steps ahead of the care plan of the patient and what needs to be done. And sometimes the patient and the family will be able to appreciate you once you discuss to them, okay, this is just what we're waiting for. We're gonna have imaging, and this is the only thing that we're waiting for, the result of your blood culture. And then the doctor will be able to know what kind of medication or antibiotics you're gonna take moving forward. So those are the mindsets and habits. You'll always have questions. Why did the doctor ordered such things without asking them why? You may connect the dots. All right. That's it, guys. 5 questions every new nurse should ask a senior nurse that will change your career. Those are the answers that I have. I hope you learned something on this vlog. Again, this is Nurse Cat. Like and subscribe. Thank you all, and good night.